So this is a video on the upper limb osteology of the appendicular skeleton. So this will cover the humerus, radius, ulna, and carpal bones. So the humerus has a head and two necks. The head articulates with the glenoid fossa of the scapula, and this forms the glenohumeral joint. And then the anatomical neck is the groove under the head, and then there's a surgical neck further down, inferior to the tubercles of the humerus, and it's called the surgical neck because it's more often fractured than the anatomical neck. The tubercles of the humerus are the greater tubercle and the lesser tubercle. The greater tubercle is the site of attachment for the supraspinatus and infraspinatus muscle, and the lesser tubercle is the site of attachment for the subscapularis and the teres minor muscles, which are all part of the rotator cuff. And there's a ridge of bone in between the two tubercles called the intertubercular sulcus, and it's also called the bicipital groove, as the biceps tendon runs through the groove. There are three fosses: the olecranon, radial, and coronoid fossa, and this is towards the proximal end, the distal end of the humerus. The olecranon fossa accommodates the olecranon process of the ulna. The radial fossa accommodates the head of the radius, and the coronoid fossa accommodates the coronoid process of the ulna. Also, in the middle of the shaft is the deltoid tuberosity, and this is the site of attachment for the deltoid muscle. The lateral and medial epicondyles are points towards the distal end of the humerus. The medial epicondyle is a site of attachment for the anterior forearm muscles, the wrist flexors, and the finger flexors, such as the flexor carpi ulnaris and the flexor carpi radialis. The lateral epicondyle is the site of attachment for the posterior forearm muscles, the wrist extensors, and the finger extensors, such as the extensor carpi ulnaris, the extensor digitorum, and the extensor carpi radialis brevis, which is often one of the main damaged muscles in lateral epicondylitis or tennis elbow. The trochlea and the capitulum of the humerus are also towards the distal end. In this picture, the trochlea is labelled, but the capitulum's not. The capitulum is located slightly more laterally, further towards the lateral epicondyle than the trochlea. The trochlea fits into and articulates with the trochlear notch of the ulna, and the capitulum articulates with the head of the radius. So the interaction between the trochlea and the trochlear notch forms the humero-ulnar joint, and the interaction between the capitulum and the head of the radius forms the humero-radial joint. The head of the radius articulates with the capitulum, and the first blue arrow just under the head of the radius is called the radial tuberosity, and this is the insertion for the biceps muscle, both the long head and the short head. The second blue arrow on the radius, that is pointing to the ulnar notch, which articulates with the head of the ulna, which is also located distally, and that forms the distal radio-ulnar joint. And the styloid process of the radius, that is the insertion for the brachioradialis muscle. On the ulna, which is located more medially, there is a trochlear notch which articulates with the trochlea of the humerus, which, like I said, forms the humero-ulnar joint. Then there's the radial notch of the ulna, and that's located more laterally towards the lateral side of the ulna to articulate with the head of the radius to form the proximal radio-ulnar joint. The coronoid process and the ulnar tuberosity, which is the blue arrow on the ulna, that is the insertion for the brachialis muscle, as it has two different insertions. And again, it has a styloid process on the medial side. So the carpal bones from lateral to medial in the proximal row is the scaphoid, lunate, triquetrum, and pisiform. And in the distal row, lateral to medial, it's the trapezium, trapezoid, capitate, and hamate. So here the S represents the scaphoid, and that is part of the proximal row. And that's located more laterally in anatomical position. So the bone below the S is the radius. And also on the radius there are notches called articular facets, which articulate the scaphoid and the lunate bones, which are labelled S and L. Here there are metacarpals and the phalanges as well as the carpals. The joint between the carpals and the metacarpals are called the carpo-metacarpal joints. The joints between the metacarpals and the proximal phalanges are called the metacarpophalangeal joints. And the joints between any of the phalanges are called the interphalangeal joints. So these joints are called the carpo-metacarpal joints. These are called the metacarpophalangeal joints, and any of these are called the interphalangeal joints. The digits of the hand are labelled from 1 to 5. So the thumb will be number 5, located laterally in anatomical position. So this will be a view of the right hand as the thumb goes outwards. So this is digit number 1, digit number 2, 3, 4, and 5, all the way up to the pinky finger. And to locate a particular part of the phalanges, there is a digit and there's also a part. So the proximal being closest to the carpals and the radius and ulna, intermediate being further away, and the distal being right at the end. So for example, this would be the proximal phalanx, which is the singular for the phalange, of digit number 5. This would be the intermediate phalanx of digit number 2, and this would be the distal phalanx of digit number 3.